Hello, it's Nicole from 92.5 XTU.
And Marisa from the Preston and Steve Show on 93.3 WMMR.
And we are so excited to welcome another amazing doctor from our friends at Virtua, Dr. Maccarone. Do people bring you macaroons?
No, they call me that, but they don't bring me anything. No swag for the doctors.
We should start a new trend.
Yes, please, when you make your appointment for pelvic floor, bring the man a macaroon.
Bring macaroon.
I love that you said pelvic floor because that is the topic we're discussing today. Something that not everybody wants to talk about, but we are here to break down the walls.
Absolutely. Listen, as a woman, I am sick of being silent about stuff that is so important. We've been silenced for too long. It is important to talk about things that affect us every single day. So when this came to us and we're talking about pelvic floor, the first thing I said was, whoa, I got two personal stories and we'll save that to the end. But let's just give a refresher for people who are watching. What does the pelvic floor encompass?
Yeah, I mean, it's funny you said breaking down the walls because that's what happens with the pelvic floor. The walls break down.
Unintended.
So the pelvic floor is basically kind of like a bowl of muscle, and it has organs that are going through it. So the urethra that you pee out of goes through it, and the vagina goes through it, and the rectum goes through it. So for the woman, she has several inborn or innate weaknesses in that support, and standing upright doesn't help, and having babies vaginally doesn't help because that all tears down the supports that are around the muscles. So there are connective tissue platforms that are under the bladder and over the rectum, and those all contribute to the pelvic floor. There are some things that are called ligaments. Ligaments, it may be not in the correct sense of the term, like you have a ligament in your knee, but there are ligaments that are more like muscles that hold the uterus to the tailbone. So all these things keep the female's organs in position until something traumatic happens to knock them loose.
Okay, right. That makes so much sense.
So when you talk about these traumatic incidents, what are some of the issues that women can be experiencing in their pelvic floor area?
So they could be experiencing heaviness or pressure, or they could even go as far as having a bulge, like something falling out of them. Other things could be functional, like bladder control issues, bowel control issues, pain issues, problems with intercourse. So there can be there's a wide range of problems that can occur, and they can be caused by things as simple as constipation or just a lot of lifting on the job. You know, nurses or people who work for Amazon, let's say, big box companies where they have to do a lot of lifting, they could certainly be traumatizing their pelvic floor without even having had a baby. Women who jump out of airplanes, so parachuters, or women in the military who jump out of airplanes, gymnasts. So anything that causes pounding on the pelvic floor could cause damage to these support structures.
So this leads me to my mom's story. So my mom just found out a couple of weeks ago that she actually has to get surgery for her drop bladder. And she goes, well, Nicole, I gave birth to two babies, and she's a kindergarten teacher. She's finally retiring, but she's like, I run circles around those younger teachers, Nicole, and up and down and running around. And so basically it was just, she's super active, wear and tear. She's 71, and she had the bulge actually. And so my brother just had a baby. My sister-in-law had the baby. And my mom's going to start watching her. And she's like, well, the doctor told me she could only sit on my lap for 6 to 8 weeks. And my mom hates to stop. So she's freaking out about this. But I'm like, Mom, you have to get it done so you could keep going. But yeah, she was pissed because she was so active. But it was basically she got older. She is super active. And this is what caused the drop bladder.
Yeah, no, I hear that. I see that every day, of course. I've seen it already today a few times. Women in general are going to want to go through a progression when they come to see us with bulge symptoms, or they may see their gynecologist first. And their gynecologist might say, okay, I can't handle this. Go see female pelvic medicine. And we would, see them, examine them, check their muscle strength, and we might recommend pelvic PT. That's an entry-level kind of therapy. We might recommend a vaginal insert. So there are vaginal inserts that a woman could manage herself. That's called a pessary. And then ultimately the woman might say, you know what, neither of those are for me, or I tried them, they didn't work, and I'm going to need to go to a surgical solution. And our surgeries typically are done through a vaginal approach, and they're very safe. Depends on, what the surgeon's plan is. I mean, what all is weak. But typically we have to address all the walls of the vagina. We don't just want to address the worst of the support. We want to address all the support so that we make sure that the woman gets, a good repair, since she's going to be undergoing major surgery and is going to be limited, like you said, for a period of time as far as her straining, her pushing, her pulling, her lifting, for sure. I actually have a YouTube video on what to expect with surgery that I shot while I was on the education committee for the American Urogyne Society, which is our national society for people who do what I do. So I was on the public education committee and did a video so the patients can watch or listen to me talk about what to expect with surgery from my perspective.
Yeah, you're a good entertainer. You have that. Most doctors we talk to are like, hello. And you're like, yeah.
I appreciate that. Thank you.
Yeah, we appreciate it too.
Absolutely. So let's actually go back to a little bit to the beginning, because you said there are some things you can do if you feel that you're weak. And I'll get into my story in a second, because my story is kind of weird, but I know that there's exercises, there's certain movements you could do. So if you start to feel maybe it's weak, it's important to go talk to your doctor first. But then what are some things that you can do before you necessarily might have to go to the surgery route?
Okay, so let's say the woman comes in and she says, "Oh, I'm really not feeling it with sex. I might be leaking. I just feel like lax. I just don't feel like my parts are where they need to be." And I examine them, and maybe they do have a little bit of a prolapse. Things are dropped a little bit, but overall, I ask them to squeeze, and really nothing happens. And I tell the woman, well, one of two things: either you don't know how to squeeze, and your muscles are fine, or you do know how to squeeze and your muscles are gone. And either way, pelvic PT would be a great way to either find the muscles or rehab the muscles. And we have, we have a huge program. We have about 6 different locations, 6 different women who do pelvic therapy, probably the largest in the region. We also have a nurse practitioner who does pelvic and sexual wellness, and that includes not just strengthening, but also relaxing and things such as yoga, which we offer for pelvic, which is really, really amazing. So we have a lot of alternative therapies.
It's so nice to be able to talk about this.
Yes.
I'm just like, there's a whole department of people. And of course there's a department of people. We just don't hear about it as much. That's why it's so exciting to talk to these doctors from Virtua.
Absolutely. And I think it's also so important to say that it is not just for women who had babies. It's not just for mothers. There's so, like you mentioned, it's military, it's adventure people, it's people who work, very strenuous jobs that could happen. And I think it's really important to make women not feel insecure about not feeling, like you said, you could have pain during sex and it could just be something about a muscle. So my story really quick was that I was on The Biggest Loser, the television show, 15 years ago, which is crazy.
Wait, 15 years ago?
Yeah, 15 years ago, which is insane. It ruined our metabolism, but I did have the best time. I mean, I really did have a fun time on the show. But anyway, I lost 105 pounds in 8 months. So I had skin surgery. So I had a full body lift. And over the course of the last 15 years, my hip flexors are a mess. And I went through like 3 different physical therapists, and they were just like, I can't figure this out. And my mom was like, I swear this is from when you got your body lift, that like they move things around. And so my last physical therapist that I went to was like, you need to go see a pelvic floor therapist. And so she did an exam, and she basically was like, yeah, your muscles got all jizzed around when you had your 180 body lift. And like, you should have went to physical therapy. It's almost like a C-section. Like I should have went to physical, but worse, because a C-section's a little bit in the front. I was cut 180. So, or 360. I was cut 360. So math was never my thing. That's why I'm on the radio. That's why you're the doctor. So anyway, I was cut, this was 12 years ago, but I was cut 360. And I should have went to physical therapy right after that to basically like the brain and muscle connection in my abdomen and pelvic floor got all flipped around. Yeah. And so like over time, it just has weakened. And so like my hips and my hip flexors took on more than like my quads and my abs. So I'm basically going back to physical therapy now to like reconnect what everything is supposed to, because little things like I could never do a full squat. And so I have the power to be able to lift the weights, but I'm like, why aren't my muscles moving? And I always thought it was like just tight hip flexors, but really they're angry because they've been overused and the other muscles haven't been overused. And I didn't even know if pelvic floor therapy was until like 2 years ago.
Yeah, it's a good band-aid.
Yeah, no, for sure. I mean, I started, before I was at Virtua as another institution, I started their pelvic therapy program in the year 2000. So early on, I was, paying attention to pelvic therapy. And when I talk to plastic surgeons, for example, they do believe that when they do some of these repairs, these lifts, that they're increasing the pressure, certainly increasing the pressure in the abdomen for a tummy tuck, let's say, but for a 360 thing, you're increasing the pressure at multiple different locations. And our pelvic therapists will definitely look at not just the muscles of the vagina. That's not, I mean, they work regionally. They don't work like focally in the vagina. They work on the core, the glutes,
Right.
the thighs. They use the ball, they use the resistance bands. So they use lots of different modalities. So they're not just treating vaginas, which a lot of the patients are like, oh, I don't want to go, because it's weird and all. And I say, yeah, okay, it's weird. I get it, but you're having a problem. And you came to see me, which is weird. So that's, why not just go weird one more time, and see.
But I'm like, how many vaginas have you seen over the course of your career? Like, you've seen one, you've seen them all. You know what I mean?
You ever go home and go, if I just see one more
Yeah.
cup of coffee.
I mean, yeah. It's like when you're in the bathroom in a public restroom and like a woman comes in, she's like, oh my God, I'm so sorry. I'm like, lady, I mean, you're not really seeing anything that we haven't seen before. It's fine.
Absolutely.
Breaking down walls. We're breaking down
walls here.
Yes. Yeah, I don't have a running tally, so I don't know, but it's a bunch.
That's actually like a funny bit for a doctor where you come home and you open up your marble notebook and then you do like sticks, like 1, 2.
Oh my God.
You just have like thousands.
Start doing that.
Just a wall in the bathroom.
Like, what is this? What are all these marks mean?
Right.
Nothing.
I'll start doing that in my office on the cork board behind me, and then we'll see if anybody can figure it out.
Listen, that is a viral TikTok if I've ever heard of. Yeah.
Kind of like one of those signs that they have at a convenience store so many days.
Yeah.
Since the last incident, just be like, this many, you're just one of the
congratulations
people I've helped.
And it's like, congratulations, you're 10,000.
I'll get some confetti. So
Yes.
Oh, you know what? Just give confetti to everybody.
I know,
everyone should be greeted with confetti.
But I do think it's important. Like, I just find, and Marisa and I are very similar in the sense where when we get to do these amazing chats with your incredible doctors at Virtua, we're talking about things that for so long people have been afraid to talk about. And like you said, it's a problem. Like, people have problems and they're afraid to go to the doctor. In fact, somebody DM'd me the other day on my Instagram and she was like, I was afraid to go to the doctor and I finally did. And, it's just talking about overall wellness. And I think a lot of times people are afraid. It's like, no, get it done now so you can feel better. Like, don't live in misery.
Yeah. I mean, we're dealing, urogynecology or female pelvic medicine, we deal with nuisance and bother, right? I mean, that's what people are coming to us for. They always ask, when is it time to do something? And I say, when it bothers you, if something's bothering you and you're not going out with your friends because you're afraid that you're going to leak, if you have a really good time and have a beer and laugh and you leak, you don't go out with your friends anymore, or you don't pick up the grandkids, or you don't jump on the trampoline with your kids, or you don't have sex. Once you're limiting your activities, you're not living anymore. So patients say to me, when is it bad enough? And I say, well, when you stop doing what makes you happy, it's bad enough. It's not me telling you it's bad enough. It's you realizing that you're not doing what you want to do.
That's awesome.
That's great. Well, if there is something to everybody who's watching this video, if there's something that hit home with you, if you have questions about pelvic floor disorders, there's also a Virtua pelvic health assessment. If you visit virtua.org/pelvic quiz, we have some answers for you from the doctors here at Virtua.
Thank you, Dr. Maccarone.
Thank you.
Thank you so much. I appreciate
it
so much. You too.
You too.
See you again.
Absolutely.
My pleasure. Bye-bye.